Hello, my name is Dennis. I am from Denmark in Europe, and this is a response to the video failed LapBand patient converted to mini gastric bypass. This video has been posted by Dr. Rudlegde, and clearly in my eyes is a advertisement for his mini gastric bypass, putting the gastric banding in a very bad light, which I disapprove of. I myself am, as the patient, a gastric banding surgery patient from year 2002. I have lost more than 100 kilos on the gastric banding, and I'm sorry, I must state for my own personal opinion that I have had nothing but positive effects from the banding. I of course also have experienced regurgitation, vomiting, and pain in my shoulder from the nerve effects in the abdomen, and those are, side effects we all know we have, unless the surgeon is an unprofessional surgeon not telling us. The problem about puking or vomiting can, as the patient was told, be caused by not chewing your food properly, by eating too much, stretching your, dilating your new stomach, or simply just filling it up. What the patient explains about not being able to swallow her own saliva is due to the physical fact that when things get stuck or too filled up in the stomach, the body tries to produce thick saliva to make things smooth and make it glide very, very fast, slide down, to try and make everything more, I would say, moist. I'm not English, so it's hard for me to explain. But the body tries to lubricate the stomach, making thick saliva. When things are stuck because you don't chew your food properly, then saliva starts. When it can't go through, it fills up and you have to vomit. The patient sounds it's not my fault. The doctor says it's my fault, but it's not my fault. It's the doctor's fault. It's everybody else's fault. I chose to, when I had my surgery, and I tell this to everyone that wants a obese reducing surgery, be it bypass or banding, get some professional help before, under, and after surgery, because you need a therapist to somehow help you clarify what's going to happen and prepare you. There's no way you as a person can prepare yourself for this surgery, because it's a kind of prison, a restricting thing you get put in your body. There's no way you can know how it will affect you physically or mentally. I myself experienced, after 2 weeks, anxiety attacks and wanting the banding out, really, because I could not binge eat as I was used to. That passed after about a month, so after 1.5 months to 2 months, I was fine. I've had my banding for 6 years, so 5 years and at least 8 months I've been great. I've had mine filled once, and I have approximately, I think, 5 or 6 milliliters of saline solution in the balloon. Not sure about the amount. I have one more. I can have it tightened one more time. I see no reason to it. But you can cheat your banding. You can cheat your bypass. Banding, eat fluent, eat fatty, greasy stuff, eat sugar, candy, whatever. It's easy. But giving away all responsibility is wrong. Maybe her balloon, the inflatable balloon on the band, was tightened too much, filled with too much saline solution compared to what she was ready for in her mind, mentally. But it is our own fault. The surgeon has to, of course, realize if the patient says, I cannot swallow anything, they must take out more water or saline solution if necessary, or tell the patient, if I take out any more, it'll be the same as the good old you, the obese one. Because this is not a miracle operation, and that is what I sense the patient thought it would be. I have my banding, and I'm thin. It does not work that way. Not banding nor bypass is a miracle. It is help to self-help. It is a way for us to get help. And it's that simple. It is not a miracle. And people tend to think that, and they get an awful shock after having surgery. I repeat, it is not a miracle. It is help so you can be able to help yourself with exercise and healthy diet habits. It's that simple. So, personally, I find it slightly perverse to badmouth banding the way that it's done in this video. It's put in a very negative light. I would, on the other hand, say if I today were told that my banding was broken or anything, would I convert in a split second? I am proud to say that when I had my banding, I was one of the youngest people in the world having a banding. And I am one of the few people, I would say, that I've known of that has had a real success with the banding. But it is very, very hard. It is not easy having a banding. It is thinking every day, but it's my responsibility, and I'm happy to be able to take that responsibility. But it's the same with the bypass. Everything is responsibility. You have to choose either dying from obesity, or dying trying, or live with the result of an operation that will help you to take responsibility. So I would say today I advise anyone, I work as an advisor personally in my own company, depending on size of the patient, BMI of the patient, and of course mental state, I would in most cases suggest gastric bypass because it is easier to live with. It's not so easy to cheat, but you can cheat. Not everyone experiences major dumping or major fat diarrhea. I know of patients that have no side effects and can eat sugar and fat basically without any problems, but they cannot eat so much. So I would still say I'm a very happy bander, and I have respect for both banders and bypassers. When one comes to the size, to a certain size, there is no way back. There is no diet. There is good enough. It's clearly surgery for me to stop the evil spiral of going downward and downward and downward. So a little bit appalled by this video, but happy there are good surgeons in this world, and I'm sure Dr. Rudlegde is. That is what I've heard. I have spoken to people that have had surgeries by him, and they all seem happy. There's been a couple of, people saying, but I've had these and these problems. But there's always problems with these surgeries. Again, it's help to self-help. It's not a miracle. So thank you for listening. Bye.